All right, part three. So this is Nurse Franny. This is part three of whatever you should probably study or at least look over um, before your like little quiz on bone tissue. This is in addition to your study with your book. This is on top of any podcast that has to do with bones, any notes that you have taken before in the class before, any voice memos that you have. This is just adding on to it. This is not your end all be all study guide for your exam, but this is pretty much an idea, a little overview. All right. So let's start with something very, very easy. Let's talk about bone marrow is the first one. What is bone marrow? What are the types? So let's just be really specific immediately. So let's just go back. Let's just go red bone marrow. Red B marrow. Also called myeloid tissue. This little bad boy over here is hemopoietic tissue that produces blood cells. Okay, so I almost called it homepoietic, but it's hemopoietic tissue that produces your blood cells. Okay, and you can find this if they ask, or if they, if on the quiz they say, they'll give you skull, they'll give you ribs, they'll give you sternum, and the heads of bones, right? So your epiphyses. Let's see. So you'll find them there, but they might also throw in diaphyses, right? They might throw your diaphysis, and they might actually exclude epiphysis just to throw you off. And they'll ask you, hey, which of these bones does not have red bone marrow? Or which of these structures does not have red bone marrow? Obviously, diaphysis does not have red bone marrow as an adult because it turns into yellow bone marrow. That's the one you eat. Has more fat cells, more adipocytes. So just to throw you off, they might actually ask you that. That'll be a pain in the ass if they did that, but just remember it doesn't have any, the diaphysis only has yellow. And here we go, yellow bone marrow. Yellow B marrow. I don't have any fancy names for it just yet. So most of your red bone marrow turns into yellow bone marrow, okay? So we're gonna go red, and then we are going to do, red to yellow, and in parentheses, we're gonna say not hemopoietic. That means that it does not produce blood cells. Next term, ossification or osteogenesis. As the name implies, it is the formation of bone, okay? Or the forming of bone. What about bone development types? Because we're talking about how it develops, right? So bone development types. Let's talk about intramembranous. So we have two types, intramembranous, membranous, and we have, endochondral. And let's define endochondral ossification, right? And this, just remember that during your infancy and your childhood, the epiphyses actually fill with spongy bone. Okay. When it comes to this endochondral ossification, the way to trigger your mind into remembering the meaning or the just this concept is understanding what happens to the epiphyses. All right. I understand that you're going to be using your book to look at certain charts, to look at certain steps for bone formation, but for the actual flashcard, just remember that while you're a kid, okay, all right, and childhood, so we have here the epiphyses, the epiphyses, they fill with spongy bone. And it's good to know this because during a test, they might actually ask you something. They might actually want you to compare an adult epiphyses with a child epiphyses, and they might ask or refer to what type of bone formation or ossification you're referring to when the epiphysis actually fills with spongy bone, okay? And it's the endochondral ossification where that happens. Now, we need to know something very freaking easy, and it's in what direction, all right? Direction, question mark, do bones grow? Exclamation mark. Very simple. We'll put a big number 1 here. They grow in length. And number 2, they grow in width. All right. Somebody might also ask you, what's the most common bone? What's the most common bone in the body? The most common type of bone. And that is the long bone. Someone might also ask you what type of growth is interstitial growth. Now remember when I said here, I'm going to put a little check mark here. In what direction do bones grow? We have length and width. So when we're talking about length, right, it is actually interstitial. I really hope that I'm pronouncing this right. Interstitial growth. And here, your epiphyses actually close when the cartilage is gone, right? And this ends in at adolescence. So we're going to put here ends at adolescence, comma, epiphyses close when the cartilage is gone. Remember, you're looking at charts, you're looking at sagittal plane views or coronal views of these bones for you to see how two bones, I'll put 2B, actually turn into one bone in interstitial growth. The second one would be appositional growth. Now, appositional growth, quite the opposite. Or pretty much just that other direction we haven't covered yet. So appositional growth, that's actually increase in width throughout life. Okay, so increase in width throughout our lifetime. Lifetime. It's Irish. Okay. Our bones never stop growing, really, especially when we consider Wolff's law of the bone. So, and I'm just going to put this all in capital. Wolff's Law, super important. Please remember that mechanisms of stress, if you're jump roping, if you're jogging, if you're doing exercise, this actually contributes to bone growth. So I'm going to put here mechanisms of stress, contribute to bone growth. And we're going to end it here and go over these little ideas for the flashcards. There were only a few. Red bone marrow or myeloid tissue, it's hemopoietic tissue, produces blood cells. So examples of bones that have red bone marrow, you have your skull, your ribs, your sternum, and your epiphyses. Yellow bone marrow goes from red to yellow, and it's no longer hemopoietic. This happens, when you're an adult. There's just more adipocytes in yellow bone marrow. Ossification or osteogenesis, the formation of bone. And we have intramembranous and endochondral ossification. The endochondral we went over. During infancy and childhood, the epiphyses fill with spongy bone. And what direction do bones grow? 1 is length, 2 is width. Associate length with your interstitial growth, all right? Remember, most common bone is long bone. But interstitial growth, it ends in adolescence, and the epiphyses actually close when the cartilage is gone. 2 bones form to 1. You can see that also with your sacrum and your pelvis, your coccyx as well. That happens there. Appositional growth, increase in width throughout your lifetime. Wolff's Law, mechanisms of stress contribute to bone growth. So you want to move the bone to not atrophy it. So that's that. That's the end of this part. I promise to finish bone tissue by the next part. So this is, I believe, part 3. Stay tuned for part 4.